Greetings, everyone. I'd also like to welcome you to today's webinar. I'm Liz Fernandez with Professional People Training, and our speaker today is Dr. Jim Roth. Dr. Roth is a distinguished professor in the College of Veterinary Medicine at Iowa State University and a member of the National Academy of Medicine. He received his DDM and PhD degrees from ISU. He's the director of the Center for Food Security and Public Health and the Institute for International Cooperation in Animal Biologics. Dr. Roth's primary area of research expertise is immunity to infectious diseases of food-producing animals. He has testified before congressional committees on biosecurity preparedness, on efforts to address bioterrorism, agroterrorism, and on the need for vaccines for foreign animal diseases. Dr. Roth served on the National Science Advisory Board for Biosecurity from 2005 to 2014. And with that, I'm going to turn the webinar over to Dr. Roth.
All right. Thank you, Liz. I'm very patient. I want to thank Dr. Spalding for inviting me to this. So today, I'm going to give a little background on why it's important to have an FMD vaccine, emergency vaccination plan for states. Review the draft plan that we close to Iowa, Winnipeg, and others, and then I'll overview how the process is developed. Draft plan that was developed, and a link to the plan. Dr. Kaizen, the state veterinarian for Iowa, has made this available on the IDALS website for anyone who may want to see what the Iowa plan looks like, especially if they're developing for their own states. And I need to emphasize at the top of the document that
Yeah, Dr. Roth, we're having a little problem with your audio. I'm not sure why.
Hello?
Yep, I can hear you now.
Okay. Is that a little?
That's better.
I'll hold the thing up closer to my mouth somehow.
Okay.
Okay. All right. So this page shows the front page of the Iowa Emergency FMD Vaccination Plan. Dr. Kaizen has made it available publicly for anybody who wants to see it. It's on the IDALS website. And I need to emphasize what it says in this box at the top, that it's a draft document containing strategy and logistics for the state of Iowa. It's subject to change, does not represent national policy or any policy of IDALS, and is for planning purposes only. A little background. In the 2018 Farm Bill, it contained an increase in funds to establish a larger U.S. FMD vaccine bank and other important countermeasures. And for a state to require or request vaccine, they need to have an emergency vaccination plan. So all states should work to develop a plan before they can expect to receive vaccine. And the plan needs to each state needs to have a plan for requesting, receiving, and storing vaccine, prioritizing vaccine use, distributing, administering, and tracking vaccinated animals. So that's what needs to go into the plan. And development of this plan was funded by a grant from NADPRP, the Farm Bill, to our center, and the state of Iowa's FMD Preparedness and Response Fund. So we had two different sources of funding. And the plan was developed with a lot of input from Iowa Department of Ag, USDA, APHIS, Veterinary Services, Iowa Livestock Industries, ISU College of Veterinary Medicine, and Extension. As I'm sure everybody's aware, there's been a North American FMD vaccine bank since the 1980s. It's currently shared by U.S. and Canada, and it has a number of different strains of FMD vaccine, approximately 2.5 million doses that can be produced and delivered within 1 to 3 weeks of USDA ordering the vaccine. Then after that, additional vaccine production, starting from scratch, can take as long as 14 weeks. The industry and USDA agreed that that wasn't an adequate bank, so they were able to convince Congress to provide increased funding in the 2018 bill, and now there's about $25 million to create a new bank, which is a U.S.-only bank that will contain quite a lot more doses of vaccine. So now that there's probably going to be a lot more doses available, we all need to be prepared to, the states need to be prepared to request those doses, and veterinarians in the industry need to be prepared to administer those doses. The stockpile will contain multiple strains because there are multiple strains of FMD requiring different vaccines. And it's vaccine antigen concentrate. It's not finished vaccine, and that's because that has at least a 10-year shelf life, whereas finished vaccine only has up to 2 years shelf life. But that also means it takes a few extra days for that vaccine, the vac, to be turned into vaccine and sent to the U.S. All of the vaccine that would be used is DIVA compatible for detecting infection in vaccinated animals. And that's very important to ensure that our vaccinated herds don't have FMD virus circulating so we can get back to FMD vaccine freedom. So one of the first things to do in developing a plan is define who has what responsibilities. So the USDA has important responsibilities. Before an outbreak, their responsibility is to acquire and maintain FMD vac for emergency response within their available budget. Then during the outbreak, they need to identify the strain or strains of FMD infecting animals in the U.S. and order finishing of the vac that matches the outbreak strain, and then potentially start distributing that vaccine within 7 to 14 days after the outbreak starts. And it's expected that vaccine will be in short supply for the first months of the outbreak, depending, of course, on how large the outbreak is. And USDA will allocate vaccine to the states based on their justified need. So the states need to request vaccine and justify their request, and will deliver the vaccine to the state's cold storage site and cover the expenses for production and delivery of vaccine to the states. Then the state's responsibilities related to vaccination is decide on the priorities for vaccine use, which species, which premises will get vaccine, request vaccine from USDA based on outbreak characteristics. So based on what's known at that time that they request vaccine, receive the vaccine from USDA and maintain it in cold storage. The state's also responsible for distributing vaccine, and in Iowa, we're planning to use USDA Category 2 accredited veterinarians to receive vaccine on for use on the designated premises in animals that are designated for vaccination. IDALS is responsible to ensure that the vaccine distribution is tracked and the usage is tracked, and to provide instructions for identification of individual vaccinated animals or groups of vaccinated animals. As I mentioned, we're planning to rely heavily on accredited veterinarians, and it would be Category 2 accredited veterinarians that are authorized in FMD administration. And as accredited veterinarians, they can carry out responsibilities on behalf of USDA. They will be responsible for picking up vaccine from the state distribution points, maintaining the cold chain and chain of custody for any vaccine they have, and properly storing and accounting for all vaccine assigned to them. They will also oversee administering vaccine to animals on the designated approved premises and record keeping. The accredited veterinarians will ensure animals are properly identified and data is in an electronic format that can be entered into USDA EMERS. And animals may be identified by group or lot if they stay together as a group or lot, or they may be individually tagged. They'll be responsible for collecting samples for compliance testing after vaccine is administered, if that's requested by the state veterinarian's office. And activities may be carried out by properly trained individuals working under the authority of the authorized accredited veterinarian. So the Iowa plan acknowledges there may not be enough accredited veterinarians to do all of the hands-on vaccination identification and so forth, but they can have properly trained individuals doing it under their authority. The livestock producers have responsibilities. They are responsible for preventing their animals from becoming infected. If animals show signs of infection, they're responsible for immediately reporting to authorities and to prevent virus from spreading to other animals and herds. They can identify the accredited veterinarian that they want to work with, and they may need to pay any fees charged by the accredited veterinarian that are not covered by the response, and that won't be known probably until the outbreak. They're responsible for providing equipment and personnel to safely handle animals during vaccination, for properly identifying and reporting movements, disposition of vaccinated animals or herds or flocks, and they have to obtain permits for animal movement if that's required. So that's a quick overview of where the various responsibilities are that we built into the plan. We began developing this in April 2020, and we produced the final draft. This plan includes ordering vaccine, cold chain maintenance, distribution to herds, delivery to animals, tracking vaccinates, and then prioritization. How will Iowa prioritize premises to be vaccinated and animal species and production types to be vaccinated, along with several other activities that are outlined in the plan. So there, first of all, would be for Iowa to order the vaccine or request the vaccine from USDA that they want. And in order to do that, Iowa will need information on the number and type of livestock in each vaccination zone in order to justify the number of doses of vaccine requested. Now, IDALS does not have a complete data set of livestock operations, including location, number, and type of animals. So the number of vaccine doses, so that will be needed. We'll need an estimate of that to request vaccine doses. And then the number of vaccine doses available will inform decisions, because the states may not get as many doses as they request. So depending on the number of doses that Iowa is told they have, that will determine the species or help them decide which species perhaps number of network premises to vaccinate. So it may not just be contiguous areas, but networked premises that need to be vaccinated. So in order to come up with an estimate of the number of livestock within a potential vaccination zone, we had one of the people working for Center for Food Security and Public Health, John McIntosh, develop an ArcGIS vaccine dose estimator. And that estimator is linked to in the plan, and the link is here also. So this estimator is developed using geographic information systems and the 2017 USDA NAS data. It can run multiple outbreak scenarios with the following variables, and these variables can be changed so the responsible officials can try various scenarios to see how many animals might be included. You can enter the infection origin. You can determine the size of the infected zone, buffer zone, and vaccination zone. And when you do that, you can also enter which species you want to vaccinate and production types in those zones. And then you'll get an estimate of how many doses would be required to do that. And this is meant to be used to quickly estimate the required vaccine. It will not give you an exact number or locations of susceptible livestock. This is just an estimate based on the NAS data. And it's far from perfect. The NAS data set is not comprehensive. Some premises are left off for privacy reasons, and it's from 2017, so it's about 4 years out of date, and it doesn't give premises level distributed, which of course is not accurate. It's probably more accurate in dense livestock counties than in counties with fewer livestock. So it works by calculating the percentage of the county, the area, covered by a control zone, multiplying this ratio by the data for that county. So if the brown here is the vaccination zone, you get an area for that zone and the percentage of the county that would be in that zone, and then you have to assume that the animals are equally distributed. This allows a quick estimate of how many vaccines you might need and will allow Iowa to put in a request for vaccine. And then in the next week or two, while waiting for the vaccine, the response incident command can go to that zone and get accurate information on the number of premises, the number of production animals in the zone while they're waiting for the vaccine to be delivered. But this is the best we can come up with based on available data. And it's available in there, and there's instructions on how to use it if anyone else would like to use it. So the issues to be considered when requesting vaccine, one of the issues is the need to estimate the likelihood that FMD will spread while waiting for vaccine to be administered and induce immunity. So you request vaccine very early, within a day or two, hopefully, of the need being identified. But then you have to wait 1 to 2 weeks for vaccine to be delivered, and then a couple of weeks for vaccine to induce immunity. So during that 2 to 3 to 4 weeks, the situation on the ground can change rapidly, perhaps. So we wanted a tool to estimate whether the FMD is likely to spread slowly or rapidly, and there's factors that could influence the spread. And again, in order to request vaccine, if you want to say, we think it's going to spread fast, so we need more vaccine, you need to have some method of documenting that. So we came up with an FMD potential spread estimator tool, which is in the plan and is also available on this website. And this was adapted from the Colorado Department of Agriculture Complexity Analysis Tool. We saw a presentation on that, and it looked like a really good way to come up with estimates. There are 14 potential factors, and this is just the top of the estimator. It only shows 3 factors. So one, the top factor is animal density in and around the control area. If it's judged to be low, you assign a value of 1, moderate, a value of 3, high, a value of 5, and you can assign any number between 1 and 5. You type in the assigned value. We came up with a weighting factor by asking numerous individuals how important is this factor compared to others, and that gives a total points for that factor. So you do that for all 14 factors. This is the bottom of the sheet with the last 3 factors to consider. And this sheet then, when you put in the factors, the weight for each of those, you get a total number of points. And if the total points is between 50 and 100, we consider it to be low potential for spread, so you can consider a smaller vaccination zone. And then as the number goes up, it's from moderate potential to high potential to very high potential for spread, to consider a larger vaccination zone, which means you would need to request more vaccine. So this is a tool intended to help determine how much vaccine to request in the first couple of days, so that as the continues, you're more likely to have appropriate amount of vaccine that's available. So for requesting vaccine, the USDA has an emergency FMD vaccine request document with a lot of questions, and that's found at this website, and this website is also on in the IDOS plan, which is the form that has to be filled out by each state to request vaccine. The decision to initiate a vaccine request will be made by the state veterinarian in consultation with the policy group, the USDA APHIS veterinarian in charge, and the district director. So in the vaccine plan, we have utilization of vaccine factors to consider for Iowa in utilization of the vaccine. The process for making vaccine decisions, and we have the policy group for Iowa would be responsible for doing that, but also the USDA FMD Red Book, Appendix E, has advice on how to prioritize and use vaccine. And in the Iowa plan, we're proposing that an FMD vaccine advisory committee made up of people with expertise in FMD vaccine and livestock production and emergency response provide input on the best way to utilize the limited vaccine available. So the plan also has information on vaccine handling, receiving, staging, and distribution, how to administer the vaccine, supplies that are needed, biosecurity for the vaccination crews and for handling vaccine, and then documenting vaccine administration, tracking the vaccine, and tracking the animals. The USDA also has a document that's to be used, premises designated for FMD vaccination management tool, how to manage those premises. And this is a several-page document supplied by the USDA, which is in the appendix to the Iowa plan. And for the Iowa plan, we also came up with a premises vaccination checklist and information management. We also came up with a biosecurity checklist for vaccine handling and administration, which is in an attachment to the plan, and options for identification of vaccinated cattle and swine. And this is first of all, there are some assumptions that are made. It may be that there'll be 25 million doses of vaccine available within weeks for the U.S. So there's a need to identify and track all vaccinated animals from the point of vaccination until the end of their life. And the optimal identification system for FMD vaccinated cattle and swine would be to have RFID ear tags and a visually identifiable permanent indication that they've been vaccinated, such as a pink USDA metal ear tag. Another assumption is that there's limited availability of the RFID and paint tags. So the current ability to identify FMD vaccinated animals will probably require a combination of approaches because there won't be enough of the official tags. So in this attachment to the plan, we've drafted options for identification if there aren't enough official tags. So then, what can be found in it that's available to anyone who wants to look at the plan. Now I'm going to talk about how we went about developing the plan. So we started in April of 2020, drafting the plan, working with IDOLs and USDA. Then by July, we had a draft of the plan, and we exercised or had a workshop on that plan using vaccination plan development workshop held by the FDS. So we had a workshop in July involving IDOLs, CFSPH, USDA, and SES. The purpose was to identify strengths and weaknesses of the initial draft plan and determine where further work was needed. Following the workshop, CFSPH, IDOLs, and representatives from USDA AVIC office met weekly, virtually, to work on the FMD vaccine plan components and to plan for the eventual tabletop exercise. During that time, we developed the vaccination crew biosecurity document, the spread tool, and the biosecurity checklist. After the initial workshop and before the tabletop in December, we had 4 different workshops by Zoom to socialize the FMD vaccination plan with industry and with accredited veterinarians. So these workshops, we scheduled them and invited the swine industry, beef and dairy industry. Then we invited swine, beef, dairy, and small ruminants all at the same time. We wanted to start by talking to each major industry individually. And then a workshop for the Category 2 accredited veterinarian. Then after those workshops, we were able to make additional changes to the plan based on feedback from those groups. And then we were ready to go to the tabletop exercise. And this tabletop was developed, the exercise was developed by TEP with support from SES, and it's intended for all states or many states to use, not just Iowa. So we were also using the exercise and learning from using the exercise for the first time. It was designed to validate the state's process for evaluating the need for and use of FMD vaccine, to request vaccine from USDA, to exercise that, and to receive, secure, distribute, track, and manage vaccine. It's also designed to determine the equipment, personnel, and supply requirements to complete vaccination based on the scenario. So the tabletop had over 2 days with various injects. The first was confirmation of FMD and the ensuing vaccine requests. The second was receiving vaccine. The third was field operations for vaccination. And the fourth was managing vaccinates. After the tabletop, TEP and SES made some additional revisions, and the version 2 has been revised with a confirmation of FMD and vaccine request as exercises. So these December 15th and 16th, 2 days from 9 in the morning to 1:30 in the afternoon. 2 modules. And then At the end of the second day, Dr. Kaizen invited a producer in northwest Iowa. Northwest Iowa is very livestock dense. That's where the exercise was centered. He presentation on how he could implement what was expected of him. And this producer had feedlot cattle, finishing pigs, and sheep. A very good presentation on the challenges he would face. He had a very positive attitude that somehow or another they could make it work, but there would be a lot of challenges. He has outside help that helps him all the time. Many of those people also might have their own animals or help other producers also, so there are biosecurity challenges there. So it's very interesting to listen to a producer perspective on this. We had, I think it was 83 participants, a good number from USDA and IDLs, 13 from industry, and then we had, SES had evaluators of the tabletop to help them make decisions on any changes for the tabletop that would be needed. After the tabletop, we developed a list of issues that needed further discussion, and we were able to resolve most of those issues. We created an after-action report from the tabletop. Then we revised the plan based on input received during the tabletop, and we posted that on IDAL's website. And then we've done further education and outreach with industry and the supporting agencies. And that's the last slide. This is the last slide. And I just want to mention that for the 2021 Farm Bill funding, NADPRP funding, one of the priorities is to develop or enhance state and tribal foreign animal disease vaccination plans to improve vaccine or animal disease outbreak response capabilities. So this is one of 3 priorities for this year's Farm Bill funding. So I would encourage states to consider applying for this funding. And again, Dr. Kaizen has made the Iowa plan available for anyone who might want to refer to it to see how Iowa's planning their response, which may help inform other states. This is the CFSPH team. This is a year or 2 old, but most of the same team members are still here. And with that, I'll turn it back to Liz for any questions and discussion.
Thanks, Dr. Roth. First of all, I want to let you know that Barb Porter-Spalding says thank you so much for conducting this briefing today. And I think you also reminded, I'm going to remind everyone at the end that we do have a FMD vaccine workshop and tabletop available for use by any state and industry that may want to use them through the NTEP. Do we have any, we do have one question in the chat. What was the greatest challenge that you identified during your work to prepare the plan?
I would say the greatest challenge is enough people to actually do the vaccination. The Category 2 accredited veterinarians that we're expecting to carry out a large part of the responsibilities. Iowa has over 1,000 Category 2 accredited veterinarians with business addresses in Iowa. Now, many of those probably wouldn't be interested in doing that, but we're hoping there are enough who would be willing to do it. We did have trouble getting engagement of the Category 2 accredited veterinarians in the planning process and informing them of what their responsibilities or what we would be counting on them to do. And I think in the coming months we'll try and reach out more to inform them that, you know, they're a very important part of the plan and we're going to be counting on them. But without them, we just don't have enough experienced hands to carry out the vaccination, identification of animals, and record keeping.
Okay, do we have any other questions? We'll give everybody a couple minutes.
Okay.
Anything in the chat. But I also want to thank Dr. Ross for the presentation today. And just to let everybody know, we do have another webinar this week on Thursday at 11 o'clock Eastern Standard Time. And the topic is decontamination in harvest, the 7 steps of sanitation. And our presenters are Stephen Wright, the Director of Food Processing for Ceralex, and Jeff Odell, the Technical Director of Marketing Manager for Lanix Disinfectants. They're our speakers for Thursday's webinar.
I will just say that this is in good experience putting together the plan. We had great cooperation from Iowa Department of Agriculture, from USDA participants, from industry, from ISU Extension, and other veterinarians in putting this together. And we had great discussion. There are a number of to figure out how to get around it. People work together to figure this out.
Okay, I don't see any other questions coming through the chat. But I will thank you again, Dr. Ross. It was a great, interesting presentation. And you do have your information up there in case people have questions and comments coming through. And with that, I'm going to tell everyone to have a great rest of your day.
All right. Thank you very much.
Thanks very much.